Hi, my name is David Emerson. I'm a long-term multiple myeloma survivor, myeloma coach, and director of People Beating Cancer. Welcome to the blog post about autologous stem cell transplant, what you need to know. If you've been diagnosed with multiple myeloma, there's a good chance your oncologist is pushing induction therapy, chemo, several courses of chemotherapy, cocktail usually, in order to bring your myeloma down, hopefully into remission. And he or she probably is also then encouraging you, prescribing an autologous stem cell transplant. The question is for you to think through your options and to think through the thinking behind your oncologist's recommending an autologous stem cell transplant. There are several questions. The important questions in my opinion anyway, are several. One, asking him or her how many transplants he or she and the facility that they work in, how many autologous stem cell transplants do they do annually? As you know, experience matters. There's nothing more important than experience. It's common for some general oncologist to only handle a dozen autologous stem cell transplants a year. Those centers of excellence handle hundreds of autologous stem cell transplants a year. You want to be at the center that has the most experience. Another question might be to turn to your oncologist and simply ask, after my autologous stem cell transplant, what's my prognosis? You could be old, young. I was 34 when I was diagnosed. You might be 50, 60, 70. Your stage, your symptoms, all might differ. Stage 1, stage 2, stage 3. Mr. Oncologist, Ms. Oncologist, after my procedure, what do you think my prognosis will be? Very simple question, but potentially very telling. The reason for that is, according to research, there's no difference in overall survival, that's length of life, that's different from progression-free or event-free survival. Event-free or progression-free are regarding the length of your first remission. Overall survival is your length of life. When people talk about average survival for myeloma, it's 5 to 7 years. As you can imagine, there have been you've read probably some accounts of people living only for a year, 2 or 3. Some people living for 10, 12, 15 years. That's essential. That's really, in my mind, the nut of the issue. So what's my prognosis? And it's fair, I think it's important to ask your oncologist, fine, do autologous stem cell transplants, on average, relate to a longer overall survival? If he or she is honest with you, he or she will say no, research doesn't indicate that. You will have, on average, a longer remission, and that's maybe what you're going for. That's completely up to you. My goal is for you, the patient, to make decisions that are best for you. All this is questions, answers, all this is education, all this is learning so that you can decide what's best for you and your caregiver too. Your caregiver might have an opinion here. To summarize, autologous stem cell transplant do not, on average, relate to longer overall survival. They do translate into, on average, more adverse events, which is a fancy way of saying side effects, short, long-term, late-stage side effects. Short term might be nausea, cataracts. I have a great deal of nerve damage. I have long-term heart damage. That's a late stage side effect. All to say, you need to figure out what's best for you. So, if you have any questions, feel free to scroll down to the bottom of the page and fire off a question or a comment. I will reply to you ASAP. Thanks for your time.